You ever wonder what the Avengers diagnoses and supplement stacks would be? This is kind of a fun thought experiment we used to do in med school, and my sister is in a grad school psych program that had this exact question, so I ran with it. So let's break it down. First though, our channel has had a lot of growth recently, and I'm super grateful for that. If you can subscribe to this video and give us a like, that'll help us a lot in growing the channel. I love doing this kind of stuff, and it helps us to continue doing it, so I appreciate that. So to get started though, why do people like superhero movies? Two reasons. We can see ourselves in them. We want to see how far we can push ourselves. That's how I at least explain it. I always like to kind of mix and match my supplement stack here and feel like Captain America with the super soldier serum and go for a big fast run and lift some heavy weights and I feel like a superhero that way. My son's called me Captain America before, and he thinks of himself as Iron Man, which is concerning given that Iron Man is an orphan. No, but really, the superheroes in these, when they're well done at least, have a nice balance of faults and powers. So the better story arcs are the ones that show their humanistic qualities, but then they rise to the occasion with these superpowers, and that's super cool, obviously. But it's also interesting to see how these powers clash with the real world. And that's where we picked Iron Man, Hulk, and Thor to talk about exactly based on the Marvel Cinematic Universe, what diagnoses they may have, and also what they might have taken to get to look like the way they do. Number one, Tony Stark, Iron Man. A quick recap for anybody who has not seen these movies, and we're really missing out here. Iron Man is a billionaire, genius, playboy philanthropist who ends up having a traumatic event and builds an Iron Man suit to do something good for the world, and then yada, 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 goes to outer space and stuff. Ultimately saves the world. Sorry, spoilers. Now for Tony's psych profile, the big ones, and they're actually mentioned sort of and featured in different movies in the series. Number one, narcissistic personality disorder. Grandiose ideas, thinks he's number one, most important guy in the room, all that kind of stuff. That was in his report dossier that Black Widow put together for him and gave to Samuel L. Jackson, Nick Fury, when they're building the team of the Avengers. That's a little obvious and is given to us. The next one is his PTSD here. And that came after the first Avengers movie. If you've seen Iron Man 3, they basically say it without saying it here, whereas having flashbacks, night terrors, panic attacks, avoiding similar situations, that kind of stuff. So it's pretty textbook PTSD. Other honorable mention diagnoses here is going to be potentially some ADHD, given his kind of constant tinkering, difficulty staying on task, interrupting people during conversations, that kind of stuff. A little overlap with narcissistic on the last one, but also alcohol use disorder. In the beginning, very probable, kind of drank sun up to sundown in the early movie. Potentially some kind of cyclothymic disorder here, maybe bipolar 2, just because he always had that kind of stimulant effect look to him and had periods of being down, but not major depressive. So kind of fits there. So this may be more in the weeds than you guys kind of came here for, but real quick, cyclothymic disorder versus bipolar 2. The difference here is the severity of symptoms and the risk for progression to a full-blown manic episode. So cyclothymic disorder, you have periods of highs and lows as you do with bipolar 1 and 2. But the difference is that in that cyclothymic disorder, the highs and lows are less disruptive to normal relationships and functioning, whereas bipolar 2, they're more disruptive, but you're still in this kind of hypomanic state. So there are plenty of high-performing individuals, artists, historical figures who likely had these hypomanic episodes, so these periods of mania, but not fully ruining their life mania. So in those cases, they may be just hyper-productive and more focused and taking risks, but not extreme risks, so those risks may pay off and they're more successful because of it. Things like that. The depressive episodes then tend to also not be the locked in a dark room, not showering, barely eating for weeks on end, and more of low but functioning, low mood, those normal SIG ECAPS features I think we talk about a little bit later here in the video. But in this case, they're going to be a little less in terms of the loss of interest in things that you like to do, feelings of guilt, low energy, concentration, attention, all those things. We also need to separate substance use from these symptoms. So there are plenty of cases where somebody with what appears to be hypomanic or manic features actually just has a very high use of amphetamines or other related stimulant medications, get them off of that, see what shakes out, and they may not have mania, they may have been misusing stimulants. Same thing with depressive symptoms. So we'll kind of get the depressive substances out of their system, get through the withdrawal periods, then kind of see what shakes out, what's left. All right, for those of you who aren't psych nerds, what's the guy taking? The PG-13 stuff, because these weren't R-rated movies. Likely any sort of supplement that can be helping brain health and calm. So L-theanine, calm and focus, it's good for that sort of thing. Magnesium glycinate, good for brain health, sleep quality, that kind of stuff. Omega-3s, creatine, kind of similar there. The DHA component of omega-3s is particularly good for brain health. It's a component of the insulation on our nerves, the myelin. But then the creatine now, we're finding in high doses may have some pro-cognitive benefits, especially if you're under high stress, like guys saving the world and, fighting aliens and stuff. What's the cool stuff you might be taking? Diving into the peptide therapy realm, looking at things like C9 or Cilac. Those have two different effects in the brain, both on anxiety relief, pro-cognitive effects potentially, BDNF release, or kind of analogous function to that. BDNF is the fertilizer of the brain, so it improves the health of neurons and synapses and that kind of stuff. These are FDA approved in the United States. They're used in Europe in situations of stroke and that kind of thing to help recovery. But that's what I guess Tony would be getting into there. Also, probably some stimulants too. So, maybe if he's going the pharmacologic route, that'd be Adderall, Ritalin, that kind of stuff, or derivatives of those, Vyvanse, etc. Ultimately, Tony's armor is really just kind of externalized anxiety management. He's built this thing, he can go inside it, feel in control again, but really, the guy needs some CBTI to help his traumatic past, deal with that, grow and move forward, which you see in the end game, looks like he had. Whoops, meant CBT, not CBTI. The difference here, CBTI is cognitive behavioral therapy for insomnia, so it's a very CBT specific use for insomnia, whereas CBT is just cognitive behavioral therapies. And there's a very common therapeutic method when treating depression and other mood disorders. Number 2, Bruce Banner, the Hole. This one's a little obvious, but he probably has an intermittent explosive disorder there as a reason for why he is blowing up and turning into a gigantic rage monster thing, to quote Tony Stark. So I think we can kind of lead at the intermittent explosive disorder for his diagnosis. Now, what should he be doing? Some sort of CBT, again, cognitive behavioral therapy or dialectical behavioral therapy to help control his outbursts, understand his triggers, that kind of stuff. Understanding how to use things like diaphragmatic breathing or monitoring his heart rate variability and his heart rate, which is actually what he does in, I think it was The Incredible Hulk, to train himself to control his explosions and turning into Hulk. Supplement-wise, what he should be doing, maybe ashwagandha for calm and those sorts of things. Looking at things again like L-theanine, potentially kava root can be beneficial here for more acute effect on GABA receptors, that calming aspect. Glycine as well. Glycine is another amino acid, part of like a magnesium glycinate for calm and sleep and that sort of thing. But what might he be taking? If we're for the green stuff that was injected into him, if this were all induced by peptides and whatnot, what might be causing the problem here? I'm looking at something like an IGF-1 LR3. We'll call those gamma gains on the peptide side of things. Alex, it's okay when things pop in your head to let them stay there. Not everything needs to be said. Put your head down in shame. What this does is it is downstream effect, like the benefits essentially of IGF-1 or I think the high growth hormone levels at the muscle level in particular, but it has some insulin-like effect, so it can drop your blood sugar too. That's why it's not very widely used and has some additional risks beyond what you would expect for something more growth hormone directed upstream from that. On the hormonal side, he's probably taking something like a trenbolone. Trenbolone is an anabolic steroid used a lot by bodybuilders because it can promote some serious gains, but comes with some serious psychiatric effects. Dr. Mike Israetel was recently talking about his experience with trenbolone and how at the high enough doses he had urges to hurt people. So it kind of fits. Most likely too, going back to a video that I just did in terms of my stack, likely has some sort of estrogen suppression in the mix too, because that's going to give you less opposition to the amplifying effects of testosterone in terms of assertiveness and perceived, slights and that kind of thing. So without the estrogen there, you're more likely to have the irritability and that explosion and that kind of thing too. So he's probably on some trenbolone, maybe some anastrozole to suppress the estrogen, and it's running away from him that way. After all, Hulk Smash is a stress response, so let's get the guy some biofeedback strategies and ways to control himself a little better. Or he can do the whole Professor Hulk thing and merge the brawn in the brain like he did in Endgame. Not a fan favorite across the board. But worry, this one's really interesting. So if you're looking at towards the end of the series there, after Infinity Wars and the first scene of Endgame, there's clearly an adjustment disorder there because he had this massively traumatic event and processing it very poorly. On top of that, some components of major depressive disorder, just given the social isolation, changes in eating habits, loss of interest in prior hobbies, That survivor's guilt aspect of it too. Just hitting all the psyche caps here. Psyche caps is the mnemonic we use for different depression symptoms. So how do we treat this therapeutically? So we need some sort of a behavioral activation. He needs to be on a quest here. So that's a redemption arc at the end of Endgame, and then going into Thor in Love and Thunder, where he kind of Rocky montages himself back to being Thor. Supplement-wise, the list is supplement-wise, what might he be taking? I went with Ibutamoren, NK677 on this one. This is a ghrelin receptor agonist, another GHRP, kind of like Ibamorelin. Quick detour. This is one of those square rhombus situations where, squares, rhombuses, but not all rhombuses are squares kind of thing. When it comes to all the different growth hormone releasing peptides, GHRPs, they kind of fall into two camps. There are ones that bind to the growth hormone releasing hormone receptor, GHRH agonists, and there are ones that bind to the ghrelin receptor, also known as the growth hormone secretagogue receptor. The idea being that if you bind to the latter, the growth hormone secretagogue, the ghrelin receptor, ghrelin also is the hunger hormone. So you're going to get a release of growth hormone, but you're also going to get potentially some hunger stimulation. So compounds that fit into each of these camps. For the growth hormone receptor, growth hormone releasing hormone receptor, that's going to be ones like sermorelin, tesamorelin, CJC1295 or 1295, whereas the latter, that growth hormone secretagogue or ghrelin receptor, that's going to be Ibamorelin, and the one we're talking about here, Ibutamoren or MK677. MK677 is actually not a peptide. It is a small molecule, right? So in this case, it is like any other medication that you may see. It is a small molecule that binds to the same receptor, and because of this, it is orally available, so you can take it as a capsule or some other oral solution, but also has different properties in the body just because of how long it can last and different metabolism and that kind of stuff. But Ibutamoren, what that does is it stimulates that ghrelin receptor for a very long time. It's got a long half-life, and in doing so, if you overstimulate that receptor, you get hungry as heck, and you get kind of psych anxiety type symptoms. If one substance matches that depressed thunder dab of muscle memory, I'd pick MK677 or Ibutamoren. In all seriousness, the whole point here is that everybody struggles, even Avengers, even high-performing individuals. In fact, high-performing individuals may struggle worse with feelings of inadequacy. I mean, maybe they're performing highly because they're compensating for something deep down here. Some need to always perform, need to always be the center of attention because they're missing something. Tony lost his parents. Thor experienced substantial loss and felt that it's his fault because he didn't go for the head. Hulk, that's kind of a unique story. But ultimately, sometimes compensation can get you through in the short term, white knuckling it through these traumatic times to finish the whole darn thing, save the world, etc. But they may be maladaptive. They may be not the best way to deal with these sorts of things. If you're currently using things to cope, substances, be it food, binging behaviors, things like this, it's not a moral failing. It is the impact of the stressful world that we often live in, especially if you're a high performer. It's important to seek help and understand that you can feel better and still function highly with the appropriate treatment. I hear this not infrequently where someone's afraid of losing their edge by dialing back that kind of inner turmoil, essentially. Don't want to go on an SSRI because what if it softens me? Don't want to stop using certain stimulants because what if they're not as animated and things like that that they need to be for whatever the job is here. You still have it inside. You're still worthy. You can still pick up Mjolnir, Thor's hammer there, as he did in Endgame. So cheesy, but I like it. I hope this is fun. I can do all kinds of these things because there are more Avengers and I've seen all the movies way too much, as you can probably tell at this point. Sentry. That would be a good one. So if you've seen Thunderbolts, Sentry is kind of explicitly an outward manifestation of bipolar disorder, with the Void, the very dark alter ego, being a major depressive episode. That one's a bit on the nose. Either way, thanks for watching. Again, please subscribe. It really helps us to grow the channel. I've said 1,000 times I love doing this stuff. If you have any feedback you want to give us, please drop a comment below. If you want to discuss a certain Avenger, if you want to talk about a certain peptide and how that might relate, I'm all ears. We want to do this for what people are actually going to watch and enjoy. Thank you.